I would want a brief intro as to what cancer is in general and how it relates to the breast.
Okay, thank you very much. So basically, cancer is an abnormal growth of cells. So the body is such that it has cells. Cells form the primary units of the body. So each part of your organ is formed by the coming together of cells, which form the organ, and then putting together the organs will form the system, and then the system, putting together the system, you get a whole human being. So they are supposed to grow in a particular way, and then at some times they die off and then new cells form. But then when it comes to cancer, the cells do not follow the normal pattern with which they grow. They grow abnormally, and then they grow out of their boundary, and then they begin to invade other organs or other tissues that are growing normally. So basically, it's an abnormal growth of cells. Relating it to breast cancer, the breast is also part of the body, and the breast also has cells. So when those abnormal growths occur in the breast, then we say that you have breast cancer.
Yes, please. Thank you for addressing that.
Okay.
Okay. So I want to ask, people consider breast cancer as exclusively a woman's disease. How is that misconception true? Like, how true is it?
Okay, so basically, to a large extent, they are right, because majority of breast cancer occurs in women, even though it can occur in men as well. WHO, like you rightly said, puts the figure between 0.5% of 0.5 to 1% of all people who get breast cancer being men. So you can imagine that the 99% are women. So the likelihood that the concentration will be on those who are more likely to get breast cancer is more. But that doesn't negate the fact that the men too can get breast cancer.
Yes, please. So in the society, we know that like 99% are in women, and that 1% goes to the men. So how can we change the narrative that breast cancer in men is not a thing?
No, so it's important to still talk about breast cancer in men. When I was in medical school, I remember something one of my lecturers said, and it's never left me. So we were having a class, and we were talking about statistics. So there was a condition, and then it was like, it's one in like 100,000 that you would get. Like it was very rare. But he made a very profound statement. He says that it is only rare as far as it doesn't concern you. But if you are that one person in 100,000 or even 100 million, for you it's 100%. So even though it's just 1% of men, if it is a particular man that it has happened to, for that man it is 100% because it's gotten the disease. So it is important that so far as the risk is there, so far as there's a likelihood that you can get it, it's still important to talk about it, so that just in case you are that one person who will form that 100% for yourself, you wouldn't miss it. So it's important.
It's important.
Yes.
Thank you. So please, can you throw more light on some early signs of breast cancer in men? Is it the same as in women?
Yes, basically, it's the same in women. We must say that most men think that they do not have a breast, but everybody has a breast. Everybody has some level of breast tissue. It is just that the breast is made up basically of fats and then of lobules, the ones that produce the milk, and then the ducts where the milk passes to the nipple. So for men, everybody is born with the breast, but then when you get to the age of puberty, that is when you see all the different changes. Yes, that for the men is suppressed, so it doesn't come out, but that for the women, it continues. So there's a little element of it there. So when the cancer attacks those cells, it will still can come out like a lump as it does for the woman. It can come out as skin changes on your breast. It can come out as dimpling, because if the lump it's pulling, it can sometimes pull the skin. So you feel like there's a dimple in your skin. And it also occurs in the woman. So when it comes to the signs, they are basically about the same. And I must say that it's even better for the men than the women, because for a woman, depending on the size of your breast, if there is a small lump, you may not be able to pick it up early because your breast is big and it's small. But the men, fortunately for them, their breast is very flat for majority of them. So it's very easy for them to be able to pick up a lump that has formed over there. So they should rather have been picking up their lumps early and seeking treatment early. However, because in their mind, they do not get breast cancer. Even when they see it, they refuse to see. And that is where the challenge is, and that is where we have to change the narrative.
Okay. So please, and why is male breast cancer often diagnosed later compared to ladies? Because there are some, like mostly ladies, when they find a lump or when they get the symptoms, they tend to visit health facilities earlier than men do.
Okay, so basically, in the trajectory of life, women health-seeking behavior is better than men. Men don't like going to the hospital. Men don't like taking their medication. I'm not saying that because I'm a woman, but it's something that you see in your practice. So if you have a man who has hypertension, a woman who has hypertension, the likelihood that the woman who has hypertension will take her drugs is more than the man would. So basically, men, and especially African men, always want to come out as strong and healthy, because that is how our culture projects them. So when they even find something wrong with them health-wise, it takes a while before they even accept that they really have a condition that needs medical attention. So they may see the lump, it may cross their mind, but because of the way we've been tuned, they feel that, oh, it is nothing. And they would easily want to dismiss it as nothing. And when it comes to cancer, time is life. The earlier you see and you intervene, the better your prognosis of living longer, getting cured. So they delay. And because initially, in their mind, they cannot get cancer. That's the first thing. In their mind, they don't get cancer. So even if they see it, it is not cancer. And when they even begin to think that it may be cancer, they still feel hesitant to talk about it, because society hasn't really accepted that men too get breast cancer. So he may even keep it for a long time before even telling the spouse, who would definitely encourage you that, oh, let's go for treatment, let's go and seek medical care. So that is how come they present so late, even though, like I said, it is easier to pick their own than it is to pick that for the woman. But because they see, so they see, but the denial prevents them from reporting early. Denial and then ignorance, because they feel that it is nothing, oh, it will go away. So those are the reasons why.
Okay. Denial and ignorance. Okay, so we have stages of breast cancer, and I want to know, you mentioned something about time in cancer. Yes. So I want to know, are the stages like prevalence equal, like with the male breast cancer compared with the female breast cancer? And can you throw more light on the stages for us?
Okay, so like I said, so basically the staging, we have, to simplify it, we have it when it is localized. Localized means that it is restricted to your breast. It hasn't spread to any other part of your body. And then when it has metastasized, that is when it has left your breast. and gone to other places. Even for the other places too, there are grades. So initially it will go to your lymph nodes. So you can feel the lump in your breast. You can also feel it in your armpit. You can feel it around your collarbone. That means that it has spread beyond your breast. So we have carcinoma in situ where it is just limited to the boundary. Then stage 1, it is the size. We are using the size, how big it is. If it is very small, then it could be a stage 1. Then as it becomes bigger and it spread, then the stages continue to increase. For the men, you see them as stage 4 because usually around stage 3, stage 4, because they don't accept they have cancer. So it is there, it grows big, then it begins to go to their armpit, it begins to go to their collarbone. And if they are unlucky, it can go to their liver and their lungs. That one is called distant metastasis. It has spread even beyond the local area and has gone very far to other parts of the body. And that is not good because now you have to be treating the local lesion, you have to be treating the lesions, they have to the cancer is in the breast. If you don't take care of it, then it spreads, then it breaks into the skin. It has invaded the skin. So it is gone into another tissue. Are you getting my place? My point. Then it goes into your liver. My place. My point. Then it goes into your liver. Then it goes into your lungs. Then it goes into your lungs. Then it means it's invading. It's moving around, looking for more trouble to cause. It becomes, and I want to restrict it to the breast. It becomes unsightly, so you want to take it out because to the breast. It becomes unsightly, so you want to take it out because sometimes you can actually show when you stand in the mirror or when you wear a dress and it's tight, if it is that big, or it can give you visible changes in the size of your breast. For women, basically everybody has one breast is bigger than the other, but if you have a huge lump sitting in there, it will become very obvious that one of your breasts is bigger than the other. And then also, I want to say that if you find a lump in your breast and we even feel that it is not malignant, especially if you're above 40, it is still not malignant, means not cancer, the cancer that causes trouble, yes. And if you're above 40, it is still important for us to take some and go and check to be extra sure that it is really not the benign tumor, but it's not a malignant tumor, but then it is the benign tumor. But a lot of young ladies walk around with the lumps, and we check, and it is not cancer. So not all lumps are cancer lumps. And when it's October, it's very important for people to understand that because it brings down the anxiety. Because a lot of people get scared. Immediately you say, oh, I felt something in your breast. Then it's like, my whole world has come to an end. It shouldn't be like that.
Yes, please. Thank you very much. So the next question is, do men participate in routine screenings like the mammograms and the rest? Like, do they partake in it?
Okay,
before,
so it's interesting when during this month, the Pink October month, and I've been doing this for like 7 to 8 years now. Most of the young men are excited to get screened when we go on the field. But sometimes they just want a nice female doctor or nurse to examine them. So they come, and one of the things we do is that most of the people on the team are female so that people will feel comfortable. So they'll come and sit down and tell you to examine for them. And we do. So when we go on the field, a lot of the men actually come out in the corporate organizations. They come out to get screened, but they don't routinely do mammogram. You see, mammogram is such that you have to put the breast in between the machine and press the breast. And some of the men, basically, there is nothing there to press. Yes. So yes, mammogram, no. Ultrasound, not routinely. But then the physical examination, they should do, and then they should also present themselves during the month of October so that we do it for them. For them, it's very short. For the women, sometimes because of the size of the breast, you have to lie down. For the men, they just sit in a chair and we tell you that raise your hand, and papa, we are done. So within a very short period, we are done with you. So it's important for them to come around and get checked. But they don't routinely do mammograms and ultrasounds like the women.
Yes. But please, is the ultrasound really effective?
It depends. Ultrasound is operator dependent. If you say it's operator dependent, it means that whoever is, depending on the skill of the one who is scanning. So you can have highly experienced people. If they see a lump, by the features of the lump, they can say that, oh, this lump looks like cancer, this one doesn't look like cancer. So it depends on the skill of the operator. That's the first thing. But it has its place, especially if you are below 40. It has its place. But for the men, we don't routinely do ultrasounds for them. Unless we feel that there is a lump, then yes, we'll do an ultrasound for you. And if we find the lump and we do the ultrasound, and the ultrasound is suggesting that it could be cancer, then we go ahead and take a small bit of the lump. It's called a biopsy. We take it to the lab and we go and check whether really it is cancer or not. So for men, we can do ultrasound for them. We can do biopsy if it is needed, so that we can correctly diagnose them if they have cancer.
Okay, I'm very curious. Please, how is the biopsy process like? Is it like, are you taking a liquid from the lump or? Okay,
so there is no, we are taking the tissue, a bit of the tissue of so the whole lump is sitting there, and you go with we have biopsy needles, so it's like a needle, but it's the tip is such that it can pick some of the tissue. So it pick it from different places. You don't pick it from only one. You don't take only one and you stop. So you just go in one, go in two. So you can take like 3 or 4 pieces. Then you take it to the lab and go and check. So when they are doing that procedure, they will usually give you a little bit of injection, so to numb the place, so that you wouldn't feel so much pain when they are taking that small bit out for examination. I know men don't like needles, but it's not very painful.
Okay, please, how significant is genetic testing in men, like those with family history of breast cancer, ovarian cancer?
So it's important, but in our part of the world, it's not something that is done routinely because it's expensive. And even in Ghana, we don't run the test here. Even though you can take the sample, they run it outside Ghana. So you can imagine it's expensive. So it's not something that routinely people do, but out there, they do. And as I was preparing for this, I was reading an article about one man who had gone for the genetic testing, and then there was it was positive, and he felt that he wouldn't even wait for the cancer to occur, so he went in to have a mastectomy done. So yes, it's important, but in our part of the world, because of financial constraints, we hardly do it, but it's important if you can afford it.
What does the mastectomy do?
So basically, the breast cancer affects the breast. So if the breast is not there, there will be no cancer. So they won't wait for the cancer to come before they remove the breast. They're just going to remove the breast. So then there is nowhere for the cancer to be, because the cancer is in the breast and there is no breast. So that's why they do that. It's called prophylactic mastectomy.
Okay, but the cancer can actually grow in different parts of the body.
Yes, but you see, for the ones who have the genetic one, the BRCA1 and 2, is specific more for breasts. So the BRCA1 and 2 is known to cause breast and prostate. So if you take the breast out, then obviously it cannot affect the breast. It's not like once you have BRCA1 and 2, it can cause cancer in different parts of your body. It's specific to some cancers. So they go and remove the breast so that there will be no breast for the cancer to even start developing.
Yes, please. Thank you very much. So if you are now joining the talk, we are talking about breast cancer in men, and it has been noticed that most men miss screenings because of ignorance and then traditional beliefs, and we are urging everyone to partake in breast screenings, especially in this month, as it is a month for breast cancer awareness. We are live on Facebook and YouTube, and you can also send in your suggestions in the comment sections. We'll go for a short commercial break. Stay tuned.
With the growing challenges of life in light of both global and domestic development, the Christian is faced with the difficult task of balancing survival within a secular system and at the same time living a Christian life that pleases their Maker. It is for this reason that we need to have frank conversations on the many issues of life through the Christian lens. So, we bring to you Let's Talk About. On Let's Talk About, we talk about health, career, dating, marriage, family, divorce, politics, finance, and all the issues of life that the Christian is confronted with on a daily basis. Join us this and every Wednesday on the YouTube and Facebook pages of Trinity United Church Legon, and let's talk about life as Christians. With the growing challenges of life in light of both global and domestic development, the Christian is faced with the difficult task of balancing survival within a secular system and at the same time living a Christian life that pleases their Maker. It is for this reason that we need to have frank conversations on the many issues of life through the Christian lens. So, we bring to you Let's Talk About. On Let's Talk About, we talk about health, career, dating, marriage, family, divorce, politics, finance, and all the issues of life that the Christian is confronted with on a daily basis. Join us this and every Wednesday on the YouTube and Facebook pages of Trinity United Church Legon, and let's talk about life as Christians. With the growing challenges of life in light of both global and domestic development, the Christian is faced with the difficult task of balancing survival within a secular system and at the same time living a Christian life that pleases their Maker. It is for this reason that we need to have frank conversations on the many issues of life through the Christian lens. So, we bring to you Let's Talk About. On Let's Talk About, we talk about health, career, dating, marriage, family, divorce, politics, finance, and all the issues of life that the Christian is confronted with on a daily basis. Join us this and every Wednesday on the YouTube and Facebook pages of Trinity United Church Legon, and let's talk about life as Christians.
Okay. You are welcome back from the commercial break. And remember, we are still live on our social media platforms, Facebook and YouTube, Trinity United Church Legon. You can also send in your suggestions on our WhatsApp numbers. We've been talking about breast cancer in men, and we've had a lot of insights. Doctor, you're welcome back from the break.
Thank you so much.
So the next question is, what are the major risk factors that increase the likelihood of a man developing breast cancer?
Okay, so I think the major, one of the major ones is age. So as men age, their chances of getting breast cancer also increases. So the likelihood of you getting a young man with breast cancer is very minimal. But as they age, the likelihood of them getting cancer also increases. And then obesity. Obesity also increases their risks of cancer. Liver disease. So I'll tie that in with alcohol abuse. Also increases their risks of breast cancer. There is a genetic condition where it's called Klinefelter syndrome, where instead of, you know that women, we have double XX chromosome, the men have XY chromosome. In the Klinefelter syndrome, they have double X and a Y. So then their female traits also increase. So estrogen is more than it's supposed to be. So it increases their risk of getting breast cancer. If you have direct radiation to your chest, it increases your risk of getting breast cancer. And by radiation, I mean having undergone radiotherapy treatment for other conditions, but it's to your chest. It increases your risk of getting breast cancer. Some conditions in the testes also increase your risk of getting breast cancer. And then when men get prostate cancer, they are given some hormonal drugs, which includes estrogen. And that also increases their risk of getting breast cancer. Usually when it comes to breast cancer, estrogen sets, you cannot take estrogen out of the breast cancer conversation. And estrogen is a hormone. So and the reason why it's more common in women is because women have more estrogen. It gives us our features. But men too have a bit of estrogen. It helps them regulate their sexual and reproductive health. However, if the level of estrogen in them increases, then it increases their risk of breast cancer. So if you are on prostate medication and then you are given estrogen drugs to control that, it now puts you at risk of getting breast cancer. And of course, the genetics. So if there is a family history, it runs in your family, the BRCA gene runs in the family, then it also increases your risk of getting breast cancer. So those are some of the things that increases the risk of men developing breast cancer.
Okay, thank you very much. So you've mentioned the risk. Follow up, can you highlight some lifestyle activities that men can engage in to reduce the risk of breast cancer?
Okay, so whenever it comes to risk conditions or risk factors, I must say, we always try and divide them into two, modifiable and non-modifiable. So modifiable means that you can do something about it. Non-modifiable means that you cannot do anything about it. Like your age, you cannot say that you will do something to decrease your age. So age automatically becomes a non-modifiable risk factor. But something like obesity, it's weight. You can do something about it. It's lifestyle. So being active, watching what you eat, and then getting enough rest all helps you to maintain a healthy weight, which further reduces your risk of getting alcohol. Decreasing your alcohol intake also reduces your risk of getting breast cancer. So for the men, so those are some of the things. Basically, lifestyle changes can decrease your risk of getting breast cancer. So they should watch what they eat. We have the boys. They will meet Friday night, Saturday night, over pork and alcohol, and they will chat deep into the night. By the time they are leaving, you have like 20 bottles on their table. It's not healthy. And then some too, for us Christians, we are not supposed to be drinking, but then we eat huge meals at a time because we feel that Obema Day so didi. So you eat and eat and eat, and then you are gaining weight, you are developing your pot belly. When you're married, then they say their wife is taking good care of them. So then it means they have to get small pot belly. You are becoming obese. You are increasing your risks of getting the breast cancer and other disease conditions which are not very healthy as well. So yes, men should be active. They should eat well, more fiber, less fats, less carbohydrates, more fiber, drink enough water, get enough rest, and then that way they help protect themselves.
Thank you. So we have a question from Patricia SL. She says, Is that the reason why it is called invasive metastatic carcinoma? Because they have traveled to other parts of your body.
Yes. So they are invading other places that they are not supposed to invade. So then that is why it is called invasive. So if you and it's very, most of them are also very aggressive. So it goes very fast. So today is small, the next minute it's become large. So the invasion it attaches to the skin, and the next minute it's even breaking the skin and causing a wound in the skin. So it can do all that. And metastasis basically means it's moving away from where it's supposed to be. So they are busily running off to other organs to go and cause havoc over there. So that is why it's called that.
Okay. Patricia, I hope your question is answered. So many men feel embarrassed to raise concerns about breast lumps and the changes in their breasts. How can we raise awareness for them to be able to come out and even support the whole breast cancer awareness campaign?
Okay, so I must commend your church for treating this topic. I got the outline of what we were going to do this month, and then I saw this and I'm like, oh, that's a good one, because a lot of people don't talk about it. So that is where we start from, awareness creation. Because like I said, some is due to ignorance, some is due to denial. So some don't even know. And how would they know if we don't tell them? So platforms like these, letting them know that there's a likelihood that a man can also get breast cancer, that is the start. When they know that, society gets to know that, oh, men too can get breast cancer, and a man thinks that there is a lambda might be cancer or is suspicious, he will feel confident to tell somebody that, hey, actually, I think something is going on with me. But because already we feel that it's not supposed to happen to them, when they feel they have a lump, they feel embarrassed about it, because it's like, hey, this isn't supposed to be happening to men, and it has happened to you. Am I not man enough? So that is where the mindset has to start from, awareness creation, letting men know that it can happen. When it happens, you can get help. And when you get help early, it increases your chances of survival. Once we do that, then they'll be more willing to embrace that, okay, we have this, let me quickly do something about it and get. So definitely awareness creation, definitely cultural mindsets that tells people that it's okay for a man to also feel unwell. Usually it happens to us doctors and clinicians. Immediately you are not well, and then you tell a friend that, oh, I don't feel well. It's a doctor, so we are. As if the disease, well, when the disease is coming, it doesn't know whether you're a doctor or not. It's the same way when the cancer is coming and it's attacking the breast. It doesn't really care whether it's that for a woman or a man. So they have to know, and that is where we start from.
Okay, thank you very much.
You're welcome.
So how important is family support when a man is diagnosed with breast cancer?
It's very, very important. Family support is very important. Bible said that what is not good for man to be alone, I'll make him a helpmate. So men, by the way God created them, need a lot of support, need a lot of assistance, especially from women, if they are married, from their spouses. So if you happen to be a woman and your brother, your husband, your uncle is diagnosed with cancer, breast cancer, you have to give your 101% support to the person. It's a very testing time for them. A whole lot goes through their mind. Why me? Why not? What did I do? And there is a sense of guilt. But I must also say that about 50% of breast cancer even though we list risk factors and all that, the people that it affects, you can't find any of those risk factors in them. So it's not like, oh, I went to eat pork, so I'm big. That is why I've gotten the cancer. So then you begin to feel guilty. And then the people around you also begin to accuse you. You didn't take good care of yourself. That is why you've gotten breast cancer as a man. Now, Ben Masude, unya breast cancer. Then our koye, you know. So those are some of the things that we have to avoid. We rather have to, family has to be there for them. They have to reinforce their support, and then they need to pray with them. They need to share scripture with them, and then with that they begin to develop hope. Bible says that a cheerful heart is like medicine. If you are treating two people who have cancer and one is depressed and one has a very positive outlook, the likelihood that the one with the positive outlook will get better quicker is very high. So social support, what you don't want is for men to have cancer and be depressed. And if they don't get the support, the likelihood of them sinking into depression is high. So family, from not to gossip, not to call friends and say, hey, what did they see? As soon as he has gotten this. But more of, oh, let's bear our brother up in prayer and let's support him to get better. We can't say enough of it. It is very important.
Thank you very much. So we've spoken about the symptoms, we've spoken about how to prevent it and all of that. We would like to move to the treatment aspect of breast cancer. Is there any treatment? Yes,
for the men there is. For women too there is, but because we are talking about the men. Yeah. So it depends. If we can take off the breast. So some men have had mastectomies. They've had their that breast removed, and then they can follow it up with medications as well. And if it is indicated, they can do radiation. But usually it's the surgery and the medicine that they use to treat. So yes, it can be treated. That is why it is important for them to report early. Because if you report early and it is treated and it is cured, it is taken off, you can get complete about 95% cure. But if you delay and it spreads, like I said, to other organs, then your chances of survival is very limited. So yes, when we pick breast cancer in men, we treat them also. We don't say that as for you are a man, so you won't get any treatment. They get treatment for it as well.
So there are specific medications?
Yes, there are medications that target the cancer cells in the breasts for both men and women, and that is what we use. It's called chemotherapy. So we use it to treat them. We even have hormonal therapy too. So after your chemotherapy, we can give you some hormones. So if you realize that the cancer is sensitive to estrogen, we can give you drugs that would decrease your estrogen, so that once the estrogen is not there, the cancer the food is cut off, so then it doesn't go as quickly as it was.
Okay, thank you. So you mentioned treatment in men. Like, what's the key difference between the treatment in men and the treatment in ladies?
Not much difference. Basically, if you need to have a mastectomy, whether you are a man or a woman, you get a mastectomy. If you need your chemotherapy drugs, whether you are a man or a woman, you receive your chemotherapy. And if in case you need radiation, whether you are a man or a woman, you would receive the radiation. So there isn't so much of a difference in the treatments. Once it is cancer, and we know the type and we know the medicines that can help you, whether you're a man or a woman, you are given the medication.
Thank you. You can keep your questions coming. And if you had one message, yes, for men watching today about breast health, what would it be? Like, what do you have to tell them?
Okay, so I would like to say that men, you are the leaders. I mean, that's how God made it. So if you lead in the advocacy, most of the time when it's October, the men stay back. It's like, oh, it's breast, it's Pink October, it's a woman's thing. But we need all the men on board. We need them to advocate first for themselves, because they are also at risk of getting the cancer, and then for their mothers, for their sisters, for their cousins, for their friends. Usually when we go for screening, I tell the men who come and get screened that learn it. If you learn it, when you go home, you can actually use yourself as a model and teach the women in your house that, hey, this is what I went to learn. So you too do it for yourself. So it's very important. Men cannot be taken, you cannot be taken out of the breast cancer conversation. You are very important to us. We need your support in the whole campaign. So all I'll tell men is that help us in this campaign. Wear your pink ribbon, wear your pink band, wear your pink shirts, join the walks, join the awareness creations, get yourself examined, screened. Encourage the women around you to also get screened. And together, let's all help fight breast cancer.
Together, let's all help fight breast cancer. So all too soon, today's session will come to an end, and thank you viewers for joining us today. We discussed about the unspoken battle, breast cancer in men, and I was blessed with the presence of Dr. Nanama Abankwa, who is the team lead of breast cancer awareness campaign for Trust Hospital. My name is Clara Ningson, and I am your host for today's session. See you next week, same time.